So, hi Ross. Thanks
Hello.
for being here. So, how did you feel when I showed you that picture of me seeing the call for tinnitus trials when I was in Ireland in 2016?
Yeah, it's pretty blown away. That's crazy. That at the start of the journey, you just happened to be in Ireland, and when we were putting our first call out for participants to recruit them for the 10-day-1 clinical trial.
Yeah. Full circle moment.
Yeah,
right?
Full circle moment.
Pretty cool.
Crazy. And now I'm in your backyard,
I know.
seeing the FDA product being, you fitting it. Yeah, it's crazy.
That's pretty cool.
Yeah, mind blowing.
Cool.
Yeah.
Saw it from before it was a thing, before it even had a name.
Yeah.
When you think about everything you've been through, creating Lenire and kind of where you've gotten from here, did you have an aha moment at any point that you were like, this really can be something that can change people's lives?
I think we've had a few of those. One of the earliest moments was, there was a young woman who was quite stuck because of her tinnitus, and she had kind of quite a transformative experience, and I remember I felt that if I could even do that for 1 in every 10 patients, it would be worth it,
Mm-hmm.
And I think that was the aha moment for me to press ahead. And since then, I mean, just when we've gotten highly consistent clinical results across multiple clinical trials, across multiple clinical sites, across different countries, I think that is just going to continue to build on the confirmation of the credibility of the technology and the approach.
Mm-hmm. That kind of leads into the question, like there are some people out there that might be a little bit more skeptical, even though they see all this data. As somebody who cares so much about data, from a research perspective, and then somebody who cares so much about data from a clinical perspective, what do you kind of say to those people that still have that skeptical lens?
Yeah, well, I mean, we could see that skepticism early on, and we knew that the only way to bring a product to the market was to build the credibility of it. So you do that by working with the top scientists, doing the largest clinical trials. You pre-publish your clinical protocols, so you say beforehand, this is what we're going to do, and then you publish the results afterwards saying that's what we did, and you put it through the rigorous kind of peer review process, which we've done. All our large-scale clinical trials have been peer reviewed. They're in Nature and Science. They're as top tier as you get in terms of peer reviewed journals. So you can't get any more of a rigorous review of the clinical data.
Mm-hmm.
We follow all the kind of the standards, the best practices in terms of how to collect data, etc. And now what we're doing is we're starting to collect the real world evidence from providers like yourself, and we're now starting to publish that. So Dr. Emily McMahon in Alaska, we've just submitted her paper for peer review. It's in advanced stages now. We're hopeful that it will get published. There is a preprint available on the preprint server of the paper. So again, full transparency. I think we've always been fully transparent and open and submitted. Look, we understand that the skepticism, because these patients have been let down so many times, but which is why we go to all this trouble. But we will continue to publish the real world data now until I think we're probably heading towards, if we haven't already surpassed 10,000 patients with Lenire, with bimodal. So when it's 1 million patients, we will continue to publish results, and at some point that skepticism will fall away, because it'll be, I've always said, I want it to be like anesthesia. Nobody denies that anesthesia works, or nobody's skeptical about anesthesia. So that's what we're taking this in terms of clinical evidence.
Absolutely.